All right, so we're moving on to our final section of lecture number 2, looking at how we get the body parts that we have, focusing this time on the differences in sexual differentiation and development. So times when things work out a little differently than what one typically sees. So this is when things get interesting. So these are often called intersex conditions. Historically, the term hermaphrodite or hermaphroditism was used. That language is no longer used. It's considered stigmatizing and offensive. It came from the fact that Cupid, or Eros, who was the child of Hermes and Aphrodite, was actually an intersex god. And so that's where the word came from, but we now use the term intersex instead, or sometimes disorders of sexual development, or DSDs. So let's look at one potential scenario. Let's say someone is XX with their sex chromosomes, but for some reason having to do with how the gametes were made, how the sperm were put together and the chromosomes were assigned and distributed, an SRY gene ended up tagged on to one of those X's. So normally an SRY gene is only on a Y chromosome, but in this case there happens to be one tagged onto an X chromosome. So let's work through what would happen in this scenario. First of all, if you have an SRY gene, it's going to tell the gonads to become testes. So that's going to happen at 7 weeks. You're going to start making the spermatogonia, the baby sperm, and you're going to make those Sertoli and Leydig cells. This is sounding familiar. Then those Leydig cells are going to make testosterone, and those Sertoli cells are going to make Mullerian inhibiting substance, or MIS. This is sounding really familiar. That MIS is going to cause those Mullerian ducts to degenerate and disappear. And the testosterone is going to cause those Wolffian ducts to persist and develop and become the internal ductal system of the male. Really familiar. Externally, testosterone being produced by those testes, by the Leydig cells, is going to tell the external genitalia to masculinize. So again, the genital tubercle is going to become the top side and the head or glands of the penis. Genital folds will become the underside of the penis. Labioscrotal swelling will become the scrotum, and the urogenital sinus will become the urethra, the urine tube, which is inside the penis. So in this scenario, the individual has XX chromosomes, but because of the presence of that SRY gene, they have absolutely typical male reproductive anatomy, both inside and out. So when this baby is born, they're going to say it's a boy, right? They're going to assign its biologic sex as male, and it's going to develop and go through puberty pretty much just like a male, right? So now we have to think, well, what might be different? Is there any difference between somebody who's XX with an SRY gene tacked on compared with somebody who's XY? So we have to remember, what else was on that Y chromosome? Not much, but a few things. Genes for how to make sperm, and genes for how tall you are, as well as how big your hands, feet, and teeth are. So somebody who is XX with an SRY gene, this is termed XX male, right, which is okay, they will be just like a typical male in every shape and form, except they tend to be a little bit shorter than you would otherwise expect. They tend to have slightly smaller hands, feet, and teeth than you would otherwise expect, and they can't make sperm, so they're infertile, right? They can't make a baby. Pretty cool, right? So that's an interesting difference that can happen. That's one intersex condition. Let's look at another scenario. This is one where you can't see testosterone. So we haven't talked a lot about hormones and how they work yet, but one of the things that's important about them is that in order for your body's cells to see them and recognize and respond to them, those cells have to have a specialized receptor just for that hormone. And sometimes there are people who have XY chromosomes who don't happen to have testosterone receptors. So this is called Androgen Insensitivity Syndrome, because the word androgen just means male hormone. So these individuals are XY, but they can't see testosterone. So even if it's produced, their body can't recognize it and respond to it because they don't have the receptors for it. So let's take a look at what happens. So XY, which means the SRY gene is present. So at 7 weeks, the SRY gene sends that signal and the gonads become testicles. Just like any other testicles, they start making baby sperm, spermatogonia, and Sertoli and late egg cells. Those late egg cells make testosterone, and the Sertoli cells make MIS. Again, sounding pretty familiar here. So that MIS is going to do its job, and it's going to cause those Mullerian ducts, those pink tubes, to degenerate, disintegrate, and go away. The testosterone is being produced, but it can't be seen. So those poor Wolffian ducts, forgive my poor animation skills here, are going to degenerate and go away. So somebody who has androgen insensitivity syndrome, who is XY with no testosterone receptors, is going to have no internal tubes at all. They're going to lose their Mullerian ducts because they made MIS, and they're going to lose their Wolffian ducts because although they made testosterone, those Wolffian ducts, the cells couldn't see it because they didn't have receptors for it. So this is the first time things are looking different. Externally, again, the testosterone is there but can't be seen. So in the absence of testosterone that it can see, that external genitalia is going to feminize. So that indifferent genitalia is going to turn into a vulva. So this is really interesting. So this person is XY, but no testosterone receptor, right? So androgen insensitivity syndrome. Their external genitalia feminize, they have a vulva. So when they're born, we say, it's a girl, right? So now we have to think, well, when is the first time they might realize something is different? Again, my mad animation skills blew it, right? But it's puberty, right? When things start to change. And a lot of times people guess that they're not going to develop breast tissue, which is a really good guess because you would think they're not making estrogen because they have testes inside. They don't have any ducts, but they have testes. Actually, there's this weird thing that happens where if you have a lot of testosterone, you have an enzyme in your body that will convert some of it to estrogen. So as you can see, these two individuals have breast development. So they do get normal breast development. But what's the other hallmark of puberty, right? Getting your period. And these people don't have a uterus, so they do not get a period. They do have a lower part of their vagina, they just don't have that upper part because that's the part that formed from the Mullerian ducts. So also a really interesting set of physical characteristics. All right, let's talk a little bit more briefly about some other intersex conditions, some other interesting differences that can occur. So what about somebody who has XX chromosomes, but later in fetal development, towards when they're going to be born, their body starts making extra testosterone, excess testosterone, levels of testosterone that are normally not at all seen in somebody with XX chromosomes. And this is interesting because those internal reproductive structures that we talked about, the Mullerian ducts, the Wolffian ducts, develop in the early to mid parts of pregnancy. The external genitalia will develop and differentiate very early in pregnancy if the signal is to masculinize. But if they're going to feminize, although they start doing that early in the pregnancy, they can still respond to testosterone even late in the pregnancy. So that makes for a really interesting situation. So this is somebody who is XX, which means they have no SRY gene, right? So they're going to go ahead and make ovaries. And so they're not going to have MIS, so their Mullerian ducts are going to turn into the uterus and fallopian tubes and upper part of the vagina, just like you would expect. Their Wolffian ducts are going to degenerate, and their genitalia will start to turn into a vulva. Then, later in development, that testosterone comes on the scene, and what will happen is that the genitalia then starts to masculinize, right? So instead of having a typical vulva, it's going to start to grow into something that looks more like your typical male. So what we're going to see is when the infant is born, they will often have what is called ambiguous genitalia or masculinized genitalia. So it is often kind of somewhere in between what you would typically expect for an XX individual versus an XY individual. So that's where that phrase ambiguous kind of can come in. And so we can see in the image over on the left, a girl who is XX and has congenital adrenal hyperplasia where her body makes excess testosterone. And so not only do we see that the clitoris has become significantly enlarged, right, and so looks more like a phallus or a penis than a clitoris, she still has the labia majora on either side. They haven't completely fused together, but they're partially fused at the bottom there. And we see a lot of pubic hair, which is not common, right? It's very unusual in someone that young. So we're also seeing very early development of kind of those secondary sex characteristics like pubic hair development because of that excess testosterone. Another interesting intersex condition is something called 5-alpha reductase deficiency, or guaidoses. So this one's a little bit more complicated, so I'm not going to expect you to kind of know it. I'm not going to test you on it, but I'll tell you the story. So testosterone, as you know, is important for the Wolffian ducts to persist and for the external genitalia to masculinize, right? So those are the two things that testosterone typically does in an XY individual. The interesting thing is the external genitalia isn't responding to testosterone itself. In fact, in the cells of the tissues of the external genitalia, there is an enzyme called 5-alpha reductase. 5-alpha reductase turns testosterone into super testosterone, which is called DHT, or dihydrotestosterone. And it is actually the DHT that causes the genitalia to masculinize. So 5-alpha reductase deficiency is a condition that can develop in some people who are XY, but they don't have this enzyme to convert testosterone into super testosterone, which is what's needed in the genitalia. So what happens is they're XY, so they develop testes, they make MIS, and they make testosterone. Because of MIS, Mullerian ducts go away. Testosterone is there, and the Wolffian ducts can see it, so they develop and persist. They persist and develop the way they normally would. The only thing that's different is the external genitalia, because they're missing that DHT because they don't have the enzyme to make it. So the external genitalia is going to be a vulva. It's going to be the female external genitalia. So when they're born, everybody says it's a girl, and they get raised as girls, because how would you know anything different, right? Then what happens is very strange. At puberty, when all of a sudden the body ramps up hormone production, so all of a sudden you're making a whole bunch more testosterone, the external genitalia, even though it doesn't have that enzyme and can't make super testosterone, there's so much regular testosterone around that the external genitalia will start to masculinize. So the clitoris will enlarge and elongate and become a phallus or a penis. The labia majora will often start to fuse and come together to form a scrotum, and sometimes even the testicles will descend down into that scrotum. So I think the translation for guaidoses is penis at 12. And so they start off as girls, as far as everybody knows, and then puberty comes along and it's like, oh, and now we have a penis, right? And so then they go ahead and transition and live as men. And most of these people, interestingly, do identify as men, so their gender identity is usually male. Really fascinating condition. It's very uncommon. Here's the information on guaidoses in case you kind of wanted to read through it to be like, wait, what did she say? So feel free to pause if you want to read through it. Another condition that exists is something called true gonadal intersex. And so you could have XX or XY chromosomes, but for some reason your gonads turned into part ovaries and part testes, or maybe one of them is an ovary and the other one is a testicle, right? So they have both types of tissue, and then so depending on what hormones they make and in what amounts, you can get all kinds of different anatomy in these individuals. So there's no one way that somebody with this will develop. It'll depend on how much of each type of gonadal tissue they have relatively and how productive it is in terms of the hormones it produces. So really fascinating and very uncommon condition. So we've been talking about differences in development, primarily these intersex conditions. So we talked about XX male, those individuals who have the SRY gene kind of unusually present on an X chromosome instead of a Y. So they develop like a typical male in almost all ways, right? They can't make sperm, they have smaller hands and feet and teeth, and they're a little bit shorter. And then we talked about androgen insensitivity, so XY individuals whose bodies can't see testosterone, so they develop their Müllerian ducts go away, their Wolffian ducts go away, even though they have testes, they can't see that testosterone, and their external genitalia feminizes because they can't see the testosterone, and they usually don't know they have this condition until puberty comes and they don't get their period, and they don't get their period, and they don't get their period. Then we talked about congenital adrenal hyperplasia, where XX individuals have bodies that later in fetal development start making excess testosterone. So the body had primarily been feminized, but then the external genitalia starts to masculinize later on. And then we talked about guavidoses, which is kind of like some of these mushed together, right? So the genitalia doesn't masculinize all the way until puberty in those folks. So what I think is really interesting to talk about is how we have this kind of belief that biologic sex is binary. Like, it is what it is. You're a boy or a girl. You have a penis or a vulva, and that's just what you are, right? And so we're used to kind of the typical male and the typical female assortment of chromosomes and hormones and what your gonads and your external genitalia, your internal structures, your secondary sex characteristics, and what types of gametes you make. But as you've seen from this part of this lecture, right, there are all these other varieties out there, right, where you can have mixes of things that are traditionally seen as male and traditionally seen as female, and sometimes you get some things that are a little bit of both, right? So I think it's really important that we acknowledge that even from the biology standpoint, which you think would be cut or dry, one or the other, it's actually nowhere near that boring, right? There's all this kind of variety in Mother Nature in terms of all the different types of humans that exist, right? So biologic sex is not binary, right? It isn't at all. It's not nearly as simple as you're a boy or a girl. And so these are just a few intersex conditions, and there are lots of others, some of which aren't kind of as exciting. Some they're kind of milder than what we've talked about. So overall, it's estimated that probably about 1% of humans are what could be classified as intersex. So it's about as common as having red hair. But as you've seen, sometimes people don't even know that they are intersex, right? So like the XX male, if you never tried to get somebody pregnant, you wouldn't know that anything was necessarily different about you. So it's actually pretty common, and it's pretty interesting, all these different varieties that exist. So biologic sex is not binary. We have all this in-between space, and the term we use to refer to that when we're talking about biologic sex specifically is the term intersex. All right, so that's it for today. A little summary, right? So there's lots of differences. And if you know what drives typical development, then you can figure out, it's like a logic puzzle, what happens if any one of those pieces is different or altered or abnormally present or not present, right? So is the SRY gene there or not? Can you see the testosterone or not? Is there extra testosterone coming from somewhere else later on? And it's kind of a fun way to review normal development by looking at all the variations and differences that can occur. So that's it for lecture 2, how you get your body parts.